Hi, what's up, guys? Welcome back to the channel. Welcome to the station. Welcome to the podcast. My name is Ronald, and I talk about everything healthcare on this channel. And if you're new here, thank you for coming across. And please just pause the video, subscribe to the channel, then you can continue watching. Then to my returning viewers and subscribers, thank you guys for sticking around. So on today's episode, I'll be talking about the environmental health professional. There are so many occupations in healthcare that people are not aware of, or people tend to look down on, or people don't have enough information about. And the EHPs, or the environmental health professional, is one of those careers. So I'll be talking about who they are, what they do, what the career progression looks like, work-life balance, salary expectations, and what you can do to become a environmental health care professional. Now, environmental health is a very critical aspect of public health because it's designed to improve the public health and well-being, basically. So most people refer to environmental health as one of the front pillars of public health, and I tend to agree with that, even though I'm not a public health professional anyway. So, and there are 5 key areas of environmental health. Number 1 is noise and environmental pollution. You talk about food safety and hygiene. You talk about workplace or occupational health. You talk about housing standards. Then you now talk about public health generally. So anybody who is an environmental health professional will typically work in any of these areas that are just mentioned right now. So when you look at the day-to-day activities of an environmental healthcare professional, they actually carry out a wide range of duties, really, and some of them are working with other healthcare professionals to improve healthcare and well-being. That's why sometimes when you see a patient in the hospital, for example, this is in the UK, and probably they don't have proper housing sanitation standards, they probably follow up with the environmental people, and they tend to look into all of those issues. So they work with other healthcare professionals on programs to improve healthcare and well-being, or maybe decisions are being taken in some locality, they tend to consult them and all of that. Then they tend to work to protect the public from environmental hazards. They investigate complaints about neighborhood noise and nuisances. If my generator is loud in one area where I live in, you could actually call them to come and investigate. So it's within their remit to do that. They check out contaminated land, inspect food premises. So for example, people who are trying to open eateries or restaurant and all of that, so the EHPs will usually come around to inspect to make sure what you're doing is safe for public consumption. Assess risk from poor housing, investigating workplace accidents. This is occupational health. Assessing risk and advising employers on different issues around occupational health. So this is just some of the things the environmental health professional or officer does, right? And most times, it's a rewarding career, really. And in terms of pay, you typically be looking at a salary range of, again, it depends on what you're doing, probably food safety, or whether in the housing sector or you're in the regulatory services. But you should be looking at, in the UK, average salary of about, £29,000 to about £40,000, depending on what area you are in. And that's not bad. And in terms of career progression, you can progress to consultant level, you can become a director. Some people go ahead to do a master's and register with the big organizations. Some people decide to go into PhDs, and this ultimately leads them into academia, into teaching and research. So there are a lot of opportunities in terms of career progression and where you want to head on to. Then in terms of job and market vacancies, yes, there are actually a lot of opportunities because I see different posts every day. Different regions are looking for environmental health officers or professionals to come and work for them and all of that. So, and yeah, there might be professional registrations you really need to do in terms of advancing. So, I think there's Chartered Institute of Environmental Health in England. So you probably want to check them out and see what they are all about. There's Chartered Institute of Environmental Health in Wales. There's one in Northern Ireland, and there's the RIA Environment Health Institute of Scotland. So you just want to check those organizations out and see what they are all about and how they can help you progress if you're interested in becoming an environmental health professional. So I'm happy I've shed light on an interesting area of healthcare you might want to consider. And a lot of people mention that, yeah, it's interesting, being an environmental health professional. And I think the downside is people think they don't know they're there, because it seems the job of the environmental health officer or professional is mainly reactive. So a lot of the public citizens don't even know they exist or what they do until issues pop up. But anyway, that's it from me on today's episode on the show. If you've enjoyed this version, please hit the subscribe button and share this video with your friends and family. And until I see you in the next episode, I remain your host, Dr. Ron, and bye for now.